Well, hello, everyone. This is Angie Charlet with the Survey Solutions by ICAHN. I am joined today with Jake Hanson, who is our marketing and development. So today we're going to talk about patient engagement in completing your HCAHPS surveys and really start to hone in on how we can get our patients engaged to complete our surveys because of our small numbers. So hopefully by the end of today, you will have these objectives somewhat answered and ideas formulated for your own hospital location. So we're going to look at the understanding of what is allowed, not allowed from CMS, what we're allowed to share with patients and family members, some strategies to increase our response rate, some possible ideas in marketing, campaign ideas to really enhance engagement, and then the value of transparency in the public eye. All right, so what does CMS say? Well, CMS gives some very specific wording that we are allowed and not allowed to share with our patients and our family members. Just as a resource, if you go to hcapsonline.org, this is where your vendors, or if you are a hospital doing this yourself, you find all your information. Within that, there is a section called the Quality Assurance Plan. And that is the location of all the guidance that CMS allows. So CMS states that they prefer HCAHPS as the first survey a patient receives. So if your patient was in the emergency room and then they are transferred to inpatient and they're discharged, they really want them to receive that inpatient HCAHPS survey and not a survey from the emergency department. CMS states that proxy respondents are never permitted, and as a vendor of HCAHPS surveys, if we do receive something like that, we do share the information with the hospitals, but we cannot calculate that within the data that we submit to CMS. You cannot influence patient responses, and we're going to go over that a little more in depth. And CMS does not endorse the use of HCAHPS for comparisons within hospitals by department. And they share on their information page in that QA plan that it's because there's not enough data and they don't want hospital departments to compare each other. So the CMS intent is to minimize the burden on patients, prevent the introduction of bias to HCAHPS survey responses, and not deteriorate that likelihood that patients will complete the HCAHPS survey. And that is straight out of the QA plan, just so you can see it and know what exactly they're saying. So inpatient communication, what are we allowed to tell our patients? We are allowed to talk to them about the survey, but there are certain activities that are really intended to provide or assess clinical care when we are talking to our patients. So we can ask them some pointed questions about dressing changes, about medications, side effects, looking at, how their care is going, that the nurses and providers are talking to them. Activities and encounters are intended to influence how patients or how we would influence them to answer HCAHPS surveys. We are not allowed to share, and we'll go a little more in depth when we get to the next couple of slides. When asking patients about their inpatient stay, questions need to be worded in a neutral tone and not tilted towards a particular outcome. And I'll show you that here in just a minute. And questions must not resemble HCAHPS items or their response categories. And that is very explicit in the CMS guidance. All right, so some specifics. Again, straight out of the QA plan. When asking non-HCAHPS survey questions, so let's say we are rounding on patients and we're talking to them and we're gleaning information, we are not allowed to use those same answer patterns that the HCAHPS questions have. So the always, usually, sometimes, never is not permissible. It is okay for patients to be asked about their hospital experience. During their hospital stay or during discharge follow-up calls, where it's a normal part of clinical rounds, leadership rounds, or the patient treatment and care activities. Patient-initiated or hospital-initiated contact, comment, response, or communication no matter what kinds of communication we have, must not influence the likelihood of a patient receiving the HCAHPS survey. Again, twist or tilt towards the completion of that survey. All right, some more specifics. Here are some examples of questions that are not permissible. So did the nurses always answer your questions? And again, it's that word always that really is the detriment to this. On a scale of 0 to 10, how would you rate your hospital stay? Again, 0 to 10 scoring, you were not allowed to do that. Is there a way we could always, again, using that word always, did your doctor or nurse explain in a way that you could understand? And again, that is something that we have to be leery of when we start to ask some of those questions. We can ask, you know, did you understand the explanation? Did you understand the information the doctor or nurse provided you? We can ask it in a twisted but not specific like the HCAHPS questions. Overall, how would you rate the care you received from your doctors or nurses? Again, overall, how would you rate? And it's that rating that we're not allowed to ask. Now, there are some alternatives that we are going to get to that, again, you can twist and it is valid and allowable. And again, these are straight out of the CMS guidance. Are the nurses answering your questions? Again, we try not to have always in there, just very neutral tones. Please share with us how we can improve your hospital stay. Tell us about your stay. Did the doctor or nurse address any communication barriers regarding information about your health care? Or did the doctor or nurse address any concerns you may have about your health care? Was our staff attentive to your needs? Did we provide all the information you needed for your discharge? Did we answer all your questions? Utilizing teachback is another area where we can definitely have the alternative questions in here. Other areas that we can utilize, dietary and housekeeping. And I know we're going to talk about this in the marketing area, but you could have housekeeping cards and they could rate how well was your room kept clean during your stay. You know, we can use dietary cards on their meal trays and ask them to quickly just answer 2 questions about their meal. Again, it just gives you an opportunity to glean some information from them during their stay so you can make corrective actions immediately, but also it helps them to recognize that their opinion matters, their voice counts in making change. And that's what we want to stress. Now, I know this slide is very busy. And again, communicating with patients, and this is straight out of the guidance, what we're allowed and not allowed. And interestingly, when you read this guidance and you go on the HCAHPS online and look at this QA plan and the requirements, it's very explicit and repeated. You will see some of this information being repeated multiple times. You can inform the patients that they may be receiving a survey, whether it's mail or telephone, but there are some specifics we are not allowed to do. Again, very explicit. HCAHPS or HCAHPS-like questions, wear buttons displaying signage denoting always or 10, imply that there is a reward or gain benefits for positive feedback from patients. The definitely yeses and always, again, are not allowed. Looking at the hospital's goal is for all patients to rate them a 10, definitely yes or always. And again, when you're thinking about these, you know, you can change it, and we'll talk a little bit more about this in the next slide, but we want to be your provider of choice, your hospital of choice. That is allowable. So start thinking about how you can reframe that 10, you know, to a, you know, hospital of choice. We want to be the best we can be. We're not allowed to show our patients the HCAHPS survey or the cover letters during their stay, or mail any pre-notification letters or postcards letting them know it's coming. All right, so let's look at some things that comply. We are always looking for ways to improve your stay. Please share with us or comment on how we can improve. What can we do to improve your care? We want to hear from you. Please share your experience with us. Please let us know if you have any questions about your treatment plan. Let us know if your room is not comfortable, if you get too hot, too cold. Let us know if it needs to be cleaned. Again, looking at ways we can glean the same information, but not frame it in an HCAHPS question. We want to be sure we have met your needs. Please let us know if we are not addressing a concern of yours. Do you have any further concerns that we have not touched on? We want to make sure you're involved in your treatment and your care. Let us know if you have questions at any time during your stay. Are all allowable. Again, and it explicitly states things that are not allowable. And like I said, it's written in several places. Cannot wear button stickers, etc., that say always or 10. Now, you can wear some of those buttons, you know, like ask me 3, you know, when we're talking about 3 questions, you know, or just ask me, you know, and then you can have it scripting prepared for the staff. Emphasize HCAHPS response options in posters, whiteboards, rounding questions, anywhere. We cannot have those response options, you know, the always to never responses, the ratings of 0 to 10, we can't have. So we expect to be the best hospital possible. Our goal is to always address your needs. Let us know if we are not listening carefully to you. Listening carefully is, you know, the explicit in there that's like HCAHPS. Courtesy and respect, again, those are the specifics from the HCAHPS question. Our doctors and nurses always listen. You know, again, we want to avoid that and frame it a little bit differently. We want to be sure to meet your needs. You know, we want to make sure we're addressing your concerns. So, all right. And then strategies to increase response rates. And this is where we can really start to hone in a little bit more without having to ask those explicit questions. So hold people accountable, reach out to patients, follow-up discharge phone calls. This is something that everybody should be doing already. There is a billable service for this called TCM, Transition Care Management. And if you'd like more information on that, please reach out to us and we will talk you through that. But really what it is patients are receiving a discharge phone call within 2 days of discharge. We're reviewing their medications, making sure they understand their medications, that they understand the side effects, that they got their new medications filled, that they're able to keep their physician appointment in 7 or 14 days. And again, we want to ensure that we have answered all their questions. Did they need any community resources that they didn't receive or need to receive once they got home? We can also remind them of the survey that will be coming in the mail. Some things to, you know, make that survey communication part of the workflow, whether it's in the follow-up phone calls or during the daily activities when nursing staff or providers or CNAs or housekeeping, anybody can talk about in their normal daily work. Remind them of the importance of the survey responses, and it helps to improve the quality of care. You know, that the responses are anonymous, their voice is anonymous. Overall, hospital experience is important as the caregivers so that we can provide the best care possible. Make survey credible. Who is it coming from? You know, if you're utilizing an outside vendor, let them know it's coming from an outside vendor so we don't get your individual responses. You know, this is who it's going to come from. Let them know it's easy to complete, the length of time to complete it. As a nursing staff, I highly encourage all of nursing, actually all of the staff throughout the hospital to do the survey itself and to make sure that they understand the questions that are being asked. And then, you know, typically by department, you can look at some of those questions and determine how you can improve in what areas, whether it's in dietary, case management, discharge planning, housekeeping, just so they're aware of the questions, how would they answer it, and then what the expectation is for the patients to answer it. And then explain to the patients, you know, where the information goes and why that's important. You know, when we have the Ask Me buttons on, We can talk about our transparency, and we're going to get to that here in a little bit. We can resonate with the patients, what we do with this information, but also where it goes on Hospital Compare, how it's utilized to improve quality of care outcomes throughout the hospital and throughout all organizations. And then we start looking at some marketing campaign strategies. How can we change up a little bit of what we're doing? So again, you cannot use the questions themselves or the answer patterns, but you can do some digital marketing, computer screensavers. That's a great way in the hallways especially, or if we have computers on wheels, the cows that are visible where patients and or family members can see them, visitors can see them, that they have rotating loops, TV monitors in waiting areas, or even a channel on the TV in the patient rooms, waiting areas, bathroom messages. We can utilize poster displays, help us achieve 100%, help us to get to 90%, 90th percentile, and we can do some strategies of we want to be the best, we want to be the best hospital, we want to be your provider of choice. Help us get there by answering these surveys. Having thank you notes, in the room when housekeeping leaves. This is a very common practice anymore on leaving the little tents of so-and-so was here and cleaned your room while you were asleep. Dietary, having it on the trays. Looking at our social media, table tents in the cafeteria or in the waiting areas. Again, depending on your message and what you are looking at, as we start looking at our campaign ideas, we can look at different domains that we are focused on, improving our provider communication, information on medications, our expectation as a hospital for our standards of cleanliness. Our expectation is this. Please let us know when we are not meeting this expectation from you. Standards of noise levels. If we are exceeding the noise level that is bothersome to you, please let us know. How can we make it different? How can we improve without asking for their input? How we're preventing the spread of infection, that we wash our hands, we use the hand sanitizers. Make sure that we're asking, did they use their hand sanitizers? Make sure we tell the patient, please make sure you ask us if you did not see us to wash our hands or use the sanitizer or the foam in, foam out, that we do so prior to taking care of you. Again, is the hospital kept quiet during nights and weekends? What are your expectations? Here's our expectations. Please let us know if we are not meeting them. The expectations for nursing care, looking at our pain management criteria. And I know the pain questions have changed a little bit on our HCAHPS surveys, but we really want to hone in on letting them know that we care about their pain. The importance of listening, and what it means for us to be listening to our patients. The number of visits per hour by nursing staff. We're going to be coming in every hour to make sure your needs are met. We're going to ask you about your pain. We're going to ask if you need to go to the bathroom or if you need to change positions. We're going to ask these specific questions every hour. If you are sleeping, we will not wake you. However, we will be checking on you to see if you wake during any time between that and the next hour round. And then we look at transparency. And some people feel it is a detriment when we do transparency in our hospitals and announce our quality outcomes. Others feel it's value added. The Angie version that you're going to get from me, it's value added. We cannot improve without sharing where we're at. We are here, and if you're only at 80% or 75%, it's okay. You're trying to improve. You want their feedback. You want to know what it means for them and how we can improve moving forward. You want to create that culture of transparency. You want to have information shared in the main hallways of the hospital. You want to have it shared in your department, maybe in the hallways of your department. You want staff engaged. You cannot improve without the staff input. They are the front line of all that we do in our hospitals. Ask staff to take this on, make them onerous of improving. They can come up with ideas, and they are the best innovators of how to improve and how to get the patients engaged, as well as how they can hold themselves accountable for improvement methods. It really demonstrates that commitment to quality of care when we are transparent. We are owning where we're at. It'll motivate patients and families, to ask questions. What does this mean? Tell me a little bit about this. I see you're here. How are you doing? What are you doing to improve? Any idea why this number is so low? Again, we can ask questions as patients and family members. Having that endpoint, that data present may enhance survey responses, knowing that their voice counts. We have small numbers, we know that. So how do we get them to see that the response rates are very vital to hearing their voice? Promote that within the departments, promote that during their stay, during your normal workflow. Use patient comments. You don't have to put who the patient was from. And I always say display the good and the bad and the ugly. You want to share that. This is what we're doing to improve. We heard you. Our noise level has been high lately. We heard you. This is what we're doing to improve that. Demonstrates teamwork among the caregivers, how we're communicating with each other. That we're listening, but we're communicating the care shift to shift. We're doing bedside reporting, and the patients are seeing this. Promote service recovery immediately. We want to hear from you. Becomes part of our daily workflow, so the patients feel comfortable in talking about what it means to them for their pain or cleanliness, or they would just like to have their toilet cleaned, or an extra blanket, or they're hungry during the day when it's not mealtime. Utilization of the communication boards in rooms is definitely a great way for transparency. If you are focusing on any specific domain, let's say we're focusing on our discharge process and that care transitions process. So what are we doing to improve that? And on the communication boards, we can say, make sure we are addressing all your needs or any concerns you have before you go home. And it will open up those lines of communication and remind the patient and or their family members, hey, I've got this question. I have this need. I need, medications, or I have this concern for costs. And again, it just starts to frame things a little different, but it also allows us to be transparent in what we are trying to do and improve. So, and then, like I said, there are definitely ways to look at how we can be transparent. This one is Carson Tahoe Health, just looking at what does it mean to really be transparent and embracing the transparency, empowering their patients. And I just really liked, this is right on their website. If you go out there and look them up, you will see how they are demonstrating their quality focus. What information are they sharing? Is it related to HCAHPS? For most of us in critical access hospitals, we're also looking at the MBQIP measures and what that looks like. And we can share that information on the quality rating. We can share the good, bad, and ugly. Here's where we rate, and here's what we're doing about it. They give, different comparisons, where to find this information for the public and for the community when they are looking at the hospital and the providers. So again, it just gives you an idea of how you can be transparent, how you can demonstrate the quality of care, and how you can really engage your patients and family members. Tell me how I can improve in this area. And I know a lot of us use customer service programs, and I didn't want to get into any of those during this call. It was more just to share really how we can get increased response rates. And it's truly in engaging our patients and looking at what it means to them and why it's important to answer that phone when they call or fill out that survey if it comes in the mail, how easy it is to fill out the survey. Is it, how long will it take? And then we can share, I took the survey, it took me 6 minutes to complete. That provided an envelope. I put it back in the mail same day. Again, how does it reflect as you as the provider, caregiver, and what does it mean to the patient themselves? So that is it. It was just a very brief, how can we improve our response rates? Here's some ideas. I highly encourage the hospitals to create that HCAHPS team or patient satisfaction, patient engagement teams. Ask the staff. And it's not just nursing, it's not just management and leadership. It's truly asking the hands-on staff. Have someone from dietary, someone from housekeeping, a couple of nurse aides, maybe even a plant manager or a plant operations person, maintenance person. Again, you want to have a very robust team to focus on what it means to be the patient and what it means to really glean their opinion, and that their voice counts, their voice matters. We heard you. We want to hear from you. Please share your thoughts with us so we can make sure that they are engaged and that it does matter for the overall care that they receive, but also their friends and family in the community. We want to be provider of choice. So should you have any questions, again, here is all of our information. So we have myself, again, I am Angie Charlet, and Jake, who is joining me today, the Director of Technology and Marketing, and then we also have Craig Stewart, who is our Director of Business Development. So should you have any questions, please do not hesitate to give us a shout, reach out to us. We will gladly answer anything. If you want, get on our website, take a look around, and just kind of play around a little bit and say, okay, how can I improve in this area? So now I will open it up and we will go from there. So Jake.